Dear friends of the Israel Air Force Center Foundation, my name is Professor Arik Eisencraft and I am the Chief Medical Officer at Biobeat. Before joining Biobeat, I served in the IDF Medical Corps and the Israeli Ministry of Defense as the head of the CBRN Protection Division. Within the role, I was a member of the National Epidemic Team, and I have established the Institute for Research in Military Medicine in the Hebrew University Faculty of Medicine. After 20 years of service, I've retired and joined Biobeat. My friend and your Chief Operating Officer, Liat Yardeni, asked me to share with you what we do at Biobeat and why. Biobeat was founded 4 years ago with the aim of providing remote patient monitoring in a way that will allow a healthcare provider to know a patient's condition wherever he is. Moreover, most in-hospital patients and chronic patients at home are not being monitored even when it is required, as the currently used devices cannot provide what is really needed. Biobeat developed an end-to-end solution to these challenges with a complete wearable, wireless, non-invasive monitoring platform. Everything was developed in-house, including both the hardware and the software of the system. Our sensors are optical-based. By using multiple light spectrums, advanced signal processing and filtration capabilities, and incorporating our smart algorithms, we are collecting clean signals that enable us moving forward to the next generation of medical-grade monitoring. Our sensors continuously measure non-invasive cuffless blood pressure, heart rate variability, respiratory rate, blood saturation, stroke volume, cardiac output, cardiac index, systemic vascular resistance, skin temperature, movement, sweat, one-lead ECG, and more. All using one small wearable device. We have two configurations: a patch monitor that is attached to the patient's chest or a wristwatch monitor. The wristwatch monitor works for 3 days and then is recharged for up to 2 hours and is intended mainly for prolonged monitoring, such as monitoring of chronic patients at home or home care facilities. This is how it looks. The patch works for 5 to 7 days. It is disposable and intended for pre-hospital and in-hospital use. And this is how it looks. The data is collected in several measurement rates and sent through Bluetooth to a gateway or an individual cell phone if at home. From the gateway or the cell phone, it passes to the company's cloud, and from the cloud it is transferred to the healthcare providers. As it is a cloud-based system, there is no limit as to how many people can be monitored at any given time and for how long, and the data can be accessed from anywhere by the medical staff, providing relevant alerts when a change is detected. The data can be displayed on a tablet, a laptop, a monitor screen, and so on. The monitor here is actually showing my vitals as we speak. Okay, it's here, and from time to time it is updating. For each parameter mentioned earlier, an alert is set, and the caregiver can look at the trend from the moment the patient is monitored. We have FDA clearance for non-invasive cuffless blood pressure, heart rate and saturation, and CE mark approval. We follow strict HIPAA, GDPR, privacy protection and cyber regulations. The data in our cloud is de-identified. In recent months, we had a fruitful collaboration with the Israeli Air Force, and specifically with the F-35 squadrons, testing the integration of our sensors in the currently used helmets. Of course, I cannot elaborate more on that, besides saying we're excited with what we saw, and both sides aim to continue this collaboration. Nowadays, we are especially proud of our work to fight the coronavirus. The Israeli Ministry of Health has declared that the Biobeat platform should be part of the COVID-19 preparedness among isolation units in the country. As a result, and within less than 2 weeks, we have deployed our system in 20 isolation units in 14 Israeli hospitals all across the country. The IDF Medical Corps is constructing now several field hospitals across the country, and they will all be equipped with the Biobeat monitors. We were also approached by FEMA representatives talking about deployment of our platform in several field hospitals planned to be opened soon in Florida. Our sensors provide valuable information on the clinical condition of the patients, with emphasis on the cardiovascular and respiratory systems. At the same time, by using a wearable device that transmits the data in real time, we help to dramatically reduce the direct contact between patients and healthcare providers, decreasing the risk for exposure of the medical teams while not compromising the treatment and care provided to the patients. About 300 patients were monitored so far using our sensors. Moreover, by using our advanced algorithms, we've started analyzing this huge amount of data, which includes hundreds of millions of measurement points, with the aim of defining the physiological pattern of coronavirus in humans. Hopefully, this will aid soon the early detection and identification of COVID-19. I want to thank you all for your ongoing support of our beloved Israel Air Force Center Foundation. God bless you, keep safe, and happy Passover. Am Yisrael Chai.